My name is Dr. Hatem El-Aishi. I'm a professor of rheumatology at Cairo University and a consultant rheumatologist at Keppel Clinics in Cairo. Number 4, let's see what we do with a high uric acid patient first, and then we see what we do with a gouty patient. If someone has high uric acid only in the blood, we didn't say he has gout, he only has high uric acid, what do? We do two things. First, we reassure him. This is not serious, this is not a problem, this is not gout. Second, what medications do we prescribe? We prescribe for his high uric acid, the upper limit is 7 and his 8.8. What medications we prescribe? None. We prescribe no medications for the high uric acid. So we tell him go home? No, we don't. We don't tell him go home. Remember why the uric acid got high? It got high because you're overweight, you have high cholesterol, you have high blood pressure. Okay. Those conditions, are they benign conditions? Are those kind diseases or potentially really problematic over the years? They are potentially problematic. They cause atherosclerosis of the vessels. How do you get a heart disease? If those conditions are unattended, if they are not treated over the years, you can get a heart attack because of those conditions. So they are potentially serious. And the uric acid was so good when it got high because it made us alert to looking for one of those conditions. So we look for one of the common important reasons that might have resulted in an increase in uric acid. If you find it, we treat it. And we thank the uric acid from the heart. You see, the doctor here is thanking the high uric acid really. He's very happy that he found the high uric acid to look for one of those conditions that are treatable and that potentially will prevent serious problems later in life. And we explain to the patient something very important. We answer to him a question that he did not ask yet. Why uric acid decided to increase in those diseases? The reason is that it is serving a useful function in those diseases. You heard about antioxidants, of course, and vitamin A, C, E, selenium. We use antioxidants to protect our blood vessels. We don't get atherosclerosis, blah, blah, like this. Okay. Uric acid is a strong antioxidant, and it's useful to protect the vessels against atherosclerosis over the years. So, if you have high cholesterol, if you're obese, and you're susceptible to get atherosclerosis, so the body decides to tell the kidney, please don't excrete uric acid really, leave some in the blood. I want it to go higher because I want to use it to protect my blood vessels against atherosclerosis later in life. So this is why we have a high uric acid, to serve a useful function. But of course, anything that exceeds certain limits, maybe it turns into something that is really harmful, like if uric acid decides over the time to make a gout, oh, we don't like that, especially if it becomes troublesome gout. So uric acid is serving a good function. This means that if the serum uric acid is high in men and its value is like 10.3, it should not really upset me. Quite the opposite, it should make me alerted. Okay, let me look for one of those reasons that raises the uric acid, and if I find it, I will treat it. So the high uric acid in itself, we don't treat it. Up till when? We just keep it? 10, 20, 30? No. We have a ceiling, we have a limit to accept its elevations. 13 in men and 11 in women. More than 13, this is too much. Only then we decide to treat the figure. Okay, this is how we manage the high uric acid. Just reassure the patient and then look for one of the reasons that made it high. How do we treat gout? If you had the gout. If you have a first attack of gout that lasts for 1 week, we agree together that maybe you never get a second attack. Okay, khalas, no problem. We just give you painkillers. That's all. And we will not give you medications to decrease the uric acid. Although you really got the diagnosis of gout now, you have the disease, no problem. The first attack, maybe it's only the only attack you get in your life. I will just give you painkillers for 3 or 4 or 5 days. But it means high uric acid. Okay, I want to look for one of the reasons that made the uric acid high. This is the most important to me. This is the life saving over the next 10 or 20 years. And now you got the second attack. Okay, still, no problem. Maybe you never get a third attack in your life. So what I will do? Simply painkillers. Take those painkillers, but still, I will be investigating and looking and checking and making sure that your blood cluster is well controlled, your blood pressure is well controlled, check your kidney, control your weight. This is what I will do. But if you go towards, the troublesome road of third, fourth attacks onwards and increased frequency of attacks, and you're getting an attack every 1 or 2 months, this is too much. Really, you're suffering now. I cannot just tell, uric acid is not a problem. This is too much. So we will give you the painkillers when you have the attack, but now we start to consider treatment for those recurring gouty attacks. Who prescribes those medications? The rheumatologist. When does he prescribe them? After some lab tests to decide which one of the medications for gout is best for you. But it's very important to know this. This medication should never start if you are having the gouty attack. Whenever we start treatment to decrease uric acid, we start it after the complete resolution, the complete end of an attack. We never start medications that decrease uric acid during a gout attack ever. Number 6. Doc, you didn't start treatment for high uric acid when I first discovered it. You said, don't worry, high uric acid is not a problem, just let's look for the reasons that made it high. And I said, okay. Then gout happened. I had a first attack. You told me, okay, no problem, you just take painkillers and let's look for one of those reasons that raises the uric acid to treat it if we find it. Maybe you never get a second attack. And I said, okay. And then I get a second attack. And then you told me, no problem, just take those pills, take those painkillers, maybe you never get a third attack. And again I said, okay. Now I'm getting the third attack and onwards. In the end, when I got the third attack and the frequency started to really be troublesome, you said, okay, why not? Let's consider treatment. It took you such a long time to consider treatment. What's going on? Isn't gout a disease, doctor? Isn't gout a disease that should receive treatment so we don't get into complications? You are the doctor. You're the one who should treat. Why are you taking such a long time to decide to give me treatment? Maybe this is a disease. Maybe it has complications. I will tell you 3 things. The first, gout is a benign disease. Gout, if you get the first attack or second attack, it leaves you with a completely normal joint. A completely normal joint. You can jog, you can run, you can climb mountains, you can ride your bike, you can do everything you can. Unlike other diseases like autoimmune diseases, like rheumatoid arthritis, for example, those diseases, they are active and they are troublesome and they are every day in the morning, you have stiffness, and we really care to find those diseases and diagnose them early and to start treatment for those diseases early because they are not that benign. If left untreated, they are potentially really problematic. So gout is a benign disease. You know what? We know what's the difference between gout and rheumatoid, for example? Gout, consider those deposits, those salt deposits in your joint, consider that like some sort of dust that you can remove with a broom anytime you decide. Just some dust, no more. But in a disease like rheumatoid, consider what's going on in the joint, like a dog that is attempting or trying to bite the bones and to bite the cartilage and really affect the joint and cause damage in the joint. So I have to control him. But gout, it's just one attack and you're left with a completely normal joint. Second, anytime I decide, I can remove the dust in the joints. Anytime, if you have a room and it has dust, like that room on the left side, anytime I decide, I can get my broom and I will make it really shiny and wonderful. Just like that in gout, anytime I decide, I can start you on medications to decrease the uric acid and I will leave a normal joint without any deposits, but within limits. What are those limits? Look at that room. It was just dust, but if I leave the dust for such a long time, is this room really, can I clean this room with the broom and it will be shiny again? You lost this room. It's completely destroyed. It's just the same. Those are my limits. If you get the first attack, no problem. Second attack, I can remove the dust anytime. But if you go to the third, fourth, fifth, and you get a high frequency of attacks, no, the dust is too much. Those salt deposits that I consider dust are too much. And if the attacks keep recurring and we ignore them, we are leaving the joints to be destroyed over the years, over the month. I cannot accept that. And the third, and this is the answer to the question that you might be asking to yourself and to me right now. Okay, doc, why you didn't simply remove the dust from the start? Why wait? You told me that you can remove the dust anytime, it's just dust, you have medications, anytime you start your medications you remove it. So why wait all this time and make all this reluctance till you treat after such a long time? Why wait? Because why didn't start the medications to decrease the uric acid? Because if there is something that is really silly and troublesome and annoying, it is the gout medications rather than the waiting and the following up. Treatment is always a matter of weighing decisions. Like, look at this. If I follow you up and treat only the causes of high uric acid, if I compare it with giving you medications to decrease uric acid, bearing in mind that if you get a first attack, you might never get a second. And if you get a second, you might never get a third. So why would I start you on those silly medications with potential side effects? You know, if I start you on those medications, it's not a matter of 1 or 2 weeks or 1 month. You might be on them for life, for years. And they have potential side effects. So why would I start you on medications that easy? I will give you all the chances. Maybe you will be free of attacks and free of medications and leading a completely normal life. But if I discover that you're not going on that track, only then I consider the medications. Number 7. How about diet? We agree together that if you have a high uric acid over many years and it deposits, in 20% of those people where you have the deposits, you get a gouty attack. And you're waiting for a push to get an attack. One of those pushes is some foods. So what are the foods that cause gout, that trigger the gouty attack? It's not that foods cause gout. Foods trigger gout. You're already predisposed. You're already ready for the gout. Then the food comes to press the button. Food doesn't initiate gout. It just triggers the gout. Presses the button of gout. Avoid those seafoods. Anchovies, herring, tuna. There are relatively safer seafoods. They still cause gout, but they are relatively safer. Shrimp, eel, crab, lobster. Avoid beer, or at least know that beer is one of the really important triggers, the very significant triggers for gouty attacks. Avoid fructose-containing beverages. You'll find this written on the cans. It contains fructose. Avoid pigeon. Avoid those meats. Red meat, thigh, pigeon. Pigeon is eaten in the Middle East actually. Maybe in the Western cultures they are not very familiar with eating pigeon. Goose, turkey, they really trigger gout. Relatively safer meats, if you want to eat meat. Chicken, eat the thigh rather than eat the thigh better and remove better than the breast and remove the skin. Eat ribs, eat duck. Duck still triggers gout, but it's relatively safer. Liver, kidney, pancreas, all of them trigger gout. Well, try to eat less spinach, mushroom, asparagus, cabbage. So what are the safe foods? Looks like nothing is left. No, there are. Low-fat dairy products, starchy foods, whole grains, fruits, especially citrus fruits, coffee, juice without sugar, drink 12 to 16 glasses of water daily. Number 8. This is the last piece of information you need to know about gout and uric acid. Is there a relationship between high uric acid and heart disease? Some patients who are into reading a lot on the internet, they come and ask that question. Well, we know that the most important and three of the most significant reasons that cause a high uric acid are the high blood pressure, the high cholesterol, and obesity. They cause high uric acid. And we know very well that those three conditions also are accused of causing atherosclerosis and maybe heart attacks or heart disease someday. So the question was, if those three guys are related to that guy somehow, and they're related here somehow, so this guy, it will be always found in scenes when you have a heart attack, because they raise it and they cause this. So there was a question, is high uric acid related? Because you find it high in a lot of people who have heart disease, because it's related to the same conditions that cause heart disease. So is high uric acid also accused? Well, there were a lot of studies. The most important, or one of the first big studies that really studied that issue, was the Framingham Heart Study. That was in the 1970s. And I guess there was something like 6,000 something patients, 6,700 or something patients with heart disease. And they were studying the risk factors for heart disease in those patients. So they found that in those patients, there was a high incidence of obesity, the high cholesterol, high blood pressure, and high uric acid. So uric acid was accused. Why did we find you in the scene of heart disease? Statistics can help in situations like this. How? Using statistics, you can sometimes, if you have 4 factors implicated or accused, you can isolate each one of them, isolate one of them and exclude it and study it alone. Like here, you can exclude the high cholesterol and the creatinine and the blood pressure and the uric acid and study obesity alone. So when they studied obesity alone, it was accused. High cholesterol alone, it was accused, or it was implicated. And high blood pressure, it was accused. High uric acid could not be really accused of being a cause for heart disease. So uric acid is good. It's not a cause for heart disease. But when they studied groups of patients who have heart disease and who have high uric acid, and they decided, okay, it's good, it's not bad, but some patients were receiving, for some reason, treatment for high uric acid. They found that over the years, over 5 years onwards, that they had better outcome. Those patients who had medications to decrease uric acid had a better outcome. So uric acid is bad. It causes heart disease, because when I use medications to decrease uric acid, the outcome was better in patients with heart disease. So it's bad. It causes heart disease. But when they studied patients who have heart disease and who have normal uric acid, they don't have a high uric acid, but some of them, for some reason, were receiving medications to decrease the high uric acid. They found that they also still had a better outcome. So the conclusion was, some of those medications that decrease the uric acid, they have positive effects on patients with heart disease that are not related to decreasing the levels of uric acid. The final conclusion, high uric acid does not cause heart disease, and there is no scientific reason to prescribe uric acid lowering drugs in patients with heart disease. However, it is common practice in some of the cardiology societies in different parts of the world, and very especially in Japan, that if you have a heart disease, whether or not you have a high uric acid, you will be on uric acid lowering medications. The conclusion of this lecture, what most people know about gout, most of it is not correct information. Most people think that gout is salts, excess salts in the body. Any aches with a blood sugar, with a high uric acid is gout. This is not true, as we explained. The most important 8 pieces of information you need to know about gout and uric acid are those. High uric acid is one thing, gout is something else. We know now the story of uric acid, how the body produces uric acid. Uric acid within limits is useful and we need it in the body. And we know now how it goes high, and there are common conditions that are like blood pressure, blood cholesterol, obesity, and being overweight. They increase the uric acid in the blood. And we know the story of gout and how it happens, and how lazy the body is to make a first attack of gout someday. We know how to manage high uric acid. Just look for what made it high. This is the most important. And we know how to manage gout. Just wait, maybe he never gets a second if he gets a first. Maybe he never gets a third attack if he gets the second. But if he gets troublesome attacks, then we start to consider treatment. Always remember that gout medications are worse or sillier than gout itself, and this is why we keep following up the patient. Maybe we don't need to start them, and we know now what to eat and what not to eat, and we know the relationship between uric acid and heart disease. Thank you so much.